Hello, future nursing students. Welcome to a presentation on nursing, which involves science, art, theory, and research. Nursing, according to Spirituality in Nursing, is a holistic balance between art, science, intuitive, and analytic skills. We are called to care for the whole person as a Christian nurse, respecting each person as they were created by God. Both science and art are an important part in response to the grace and reflection of God's character. We're going to talk about 5 important aspects of nursing. Science is a given, right? You've probably already taken anatomy and physiology as prerequisites, and in the future you will take pharmacology. Art is a good skill to have in nursing. Patient collaboration is important because each person is different. They come from different backgrounds, different cultures, and it does take an art to talk with a patient and figure out what their goals are and how to best meet their needs. Patients also have anatomical variations. Each person is a little bit different, and you may need to use art to figure out how to perform a certain skill or procedure with someone with a variation. This is also true in wound care. There are many different types of wounds and sizes. Wound nurses really do have a skill of art to figure out which dressing to use and how to best apply that dressing. We're going to talk a lot about theory in research in nursing. Theory involves identifying patterns, problem solving, and critical thinking, which we'll talk about more. In research, we use that information to apply interventions to the patient and then monitor their outcomes. There are venues for practice changes in an organization where nurses can use research to help them decide what is the best practice for a certain procedure or practice in nursing. Patient safety committees, such as looking at fall risk, is an important collaboration. There's also collaboration between other departments, such as respiratory, radiology, etc. Leadership is important in using all of these skills to monitor and help staff with the patients. Managers can track things like falls to see what is showing as the highest cause for fall risk and what we can do to improve patient safety. So what is theory? Theories assist in explaining phenomena or relationships between items, events, or ideas. 2 different types of theories are speculative and established. Speculative focuses on assumptions, which may be helpful in some areas, but it does lack validity and reliability. In some cases, it has caused harm in the past. Infants with high oxygen administration, they found caused problems with their vision. So it is a matter of weighing the benefit versus the risk, and they saw the benefit but weren't actually noticing the risk at that time. Another example would be psychiatric patients. In the past, they have been treated with a lot of unusual physical traumatic interventions to try to force the behavior out of that patient. such as waterboarding. Established research, however, is structured, or established theory is based on structured research, and that research is replicated so that we can know it is reliable. We can then use that to predict events and how patients will react. That leads to nursing experience and how the nursing experience and theories of the past can help us to predict how things will work the best in the future. So how do we go about putting these all together? The first step would be to identify phenomena or items, relationships that you want to solve. So observation, we do a lot of things normally as a nurse, as in nursing assessments, to identify some of those things that we want to look closer at. Then we start questioning what's happening, why those things are going on. This leads to the next step of intuition. This will develop over time, where the more that you practice and know these theories, the more they become intentional factors in your reasoning. Comparing and contrasting is the next step, where you take a look at what's happening with a patient and you compare whether it's similar or different to patient experiences that you've had in the past. Once we've identified it, we need to apply theory and research through interventions for the patient, and then we would monitor the outcome of the patient. This can also mean putting changes into place, like we talked about previously, through doing research and finding out what is the best way that current research shows to accomplish a certain aspect of nursing. Collaboration is important in combining all of these, working with other departments, working with management and other teams to help figure out what is the best treatment for that patient. So as an example of putting all these things together, I want to tell you about a patient that I had. This patient was diabetic, and the CNA went in to see them and cleaned up their room, and she decided to put the patient's donuts up in the cupboard. So that patient was very upset. I got a call to go talk to the patient. So she was very upset because those donuts were comfort food to her. According to the force field analysis theory, patient may not realize that change is needed in their behavior. And so we started out at that point where the patient was just upset and wasn't thinking about her diabetes. So we did talk about diabetes, and the research on it shows that having blood sugars consistently above 180 does have an impact on the rest of the body, affecting vision, affecting neuropathy, kidneys, all kinds of other side effects. So at that point, the patient realized that yes, there is a motivation for needing change, which is called the unfreezing phase in the force field analysis theory. The stressors that the patient was experiencing was related to abuse that she'd had in the past, and so her comfort became eating. And the Newman's theory outlines those stressors that a patient experiences in general or during illness and it is in collaboration with the nurse that the patient comes back to baseline and is able to cope with those stressors. So with the art of negotiation, we talked about how many donuts the patient was going to consume that evening so that we could treat her with the right amount of insulin so that she could still feel in control but also have her blood sugars not be too high. Another important aspect is not judging the patient but caring for them so that the patient is feeling like they can make those choices and be supported. So Christian worldview in nursing goes back in history to the beginnings of nursing, where it was partially developed in the church, in parishes where people needed cared for. We go back to the times of Florence Nightingale, and we see that this was a very important aspect in caring for patients. A couple of related Bible verses are John 15:12. This is my commandment, that you love one another as I have loved you. We are supposed to love one another as ourselves and as anybody else. And this is important in nursing, that we treat those people just as anybody else would. Philippians 1:6 says, being confident of this, that he who began a good work in you will carry it on to completion until the day of Christ Jesus. Our good works are very important in nursing. We do a lot to impact patients and their health, and not only their health, but their spirit. So we do need to be confident in our calling to this field. In summary, nursing involves science, art, theory, and research. Hopefully you have seen how you can apply it in your nursing practice in the future. And I hope you have seen how a Christian worldview is related to nursing and got a glimpse of how these aspects can affect and assist in the care of individual patients with unique needs. Thank you so much. Here are my references.